We are entering yet another holiday season where hospitals are overwhelmed with sick patients. COVID infections are still a concern, but so are rising RSV and flu cases. I want to bring in Dr. Hlatshwayo Davis. She's the Director of Health for the City of St. Louis. So how is your hospital specifically dealing with the cases of flu and RSV, the enormous number of cases that we've seen in your country, in your city, but also across the country?
Well, I oversee the hospitals for the St. Louis City region, and we are already seeing record numbers of both flu and RSV cases here in the city of St. Louis, peak numbers actually for the last 4 to 5 years. This shouldn't surprise us. We knew that as we started to let go of a lot of the mitigation strategies that we used in COVID, COVID doesn't work in isolation. It's one of many, many respiratory viruses. So my expectation is that we're in for a bear of a winter.
And I'm wondering, Doctor, if part of the reason we're seeing this now is that so many kids were basically locked off and prohibited from going to certain places, and now that's not the case, and that's leading to a spike. Is that also a part of this? And then how then do we mitigate and try to reverse that?
Absolutely. And you've hit the nail right on the head. This is not a monolithic issue. There's multiple things that come into play here. At the peak of the COVID-19 pandemic, we saw record low numbers of flu specifically. Shouldn't surprise us. We were on lockdown. Yeah. We were masking in most places in the country and many mandates, a lot of masking requirements in public spaces. But you're right, especially in children who tend to have mild cases. But in those children, they were mostly at home. Schools were on lockdown. And if schools were open, there were a lot of very strict mitigation strategies. Now that we've seen all of those things lessen, we expect those numbers to come up. And so already we are seeing, my husband is a neonatal pediatric doctor in the ICU. ICUs are full. We're seeing this across the country and certainly here in St. Louis as well. So not a monolithic issue, multiple issues at play here. And amongst them, like you said, the fact that children are all back at school and most of us have resumed what we would call normal activities before the pandemic.
So here's the question then. Are state and federal government making enough resources available to deal with this so-called triple-demic?
It's tough, right? Because there aren't a lot of resources. The best tools we have in our toolbox are the two vaccines that we have available, COVID-19 and flu. I always try to remind people that you don't have to stagger them. You can get them both at the same time. Those are the best tools we have in our toolbox. But then it's understanding that the things that kept us safe during the pandemic are the things that will keep us safe here. As much as people are tired of hearing about it, if you are masking indoors, if you are masking in crowded spaces, if you're being thoughtful about social distancing, if you're washing your hands or using hand sanitizer where soap and water are not available, you are in a better spot. But that number one tool is boosting your immunity against the two that we do have antibodies for on top of that, which are COVID-19 and flu.
And Doctor, you made some great points there. This may be the only health clip people watch today. So let's run through that again. Mask up, distance, wash hands. Any other advice you can give to folks who want to avoid the triple-demic?
Yeah, I know you're tired of hearing us talk about demics at all, right? So for me, it's not about that. For me, it's whether we're in COVID-19 or non-COVID-19 times. Winter is a time where respiratory viruses are out there. So do your best to protect yourself, even if you're not on lockdown, even if it's not the same thing as during the actual pandemic, you still have to keep yourself safe. And most importantly, our children, our elderly, and people who are immunocompromised. So do the right thing.
I like that. Do the right thing.
Do the right thing.
Doctor, thank you very much. Great advice.